The best way to find yourself is to lose yourself in the service of others. Mahatma Gandhi inspired millions around the world to follow him in a movement to inspire generosity in man, woman, and children alike. My name is Kaushika Thakuriya, and this year I hope to inspire and unite and build and heal throughout my lifetime. This year I'm involved in the class ISM, which some of you know is a mentorship program where we get to choose a profession and we get to interact with our mentor and create a product and an original work. Not a lot of you don't know what this means, but hopefully throughout my presentation you'll start to understand where I'm coming from. This year I chose gastroenterology, and throughout the year I hope to meet several people in the medical profession, make relationships, and embrace the experience to the best of my ability. With this should come an understanding of the lifestyle of a gastroenterologist and the problems that they face professionally and personally. I hope to learn how this overlaps with my personal life, character, and my own personal morals. This year should teach me where I'm heading for the next 4 years of my life with a clear perception of what I want and where I want to be by the end of college. So, a little bit about me is I came from Assam, India whenever I was a month old. My father is a computer engineer, my mother was a doctor in India, and I have an older sister who goes to UTD and a dog named Simba and a cat named Giles. I used to play tennis and I was very active in it and I was very competitive. I actually quit during high school for band, in which I played flute and piccolo. I was also really, well, not very competitive, but I really enjoyed flute and piccolo more than like any other hobby. I'm also very active in art this year. I participate in competitions, and it's something I hope to continue throughout my college career. I'm college bound to UTD, and I hope to study pre-med. So, gastroenterology is kind of a big word. It didn't help that I just stumbled over it, but gastroenterology is kind of a big word, and some of you might be like, what is that? What does that even mean? The gastroenterology is a study of the digestive tract. The digestive tract is a system that functions off a 25-foot long tube that processes food, along with your liver, pancreas, and small intestine and gallbladder. The primary purpose of a GI doctor, which is the gastroenterologist, is to discover what's going wrong with the system whenever someone comes in with heartburn, rumbling, nausea, loose stools, anything like that. So they take the symptoms and try to figure out what the deeper problem is. So the first half of the year is dedicated toward research independently. So these go over a few of the research assessments that I did on my own. Argon, plasma, coagulation. Okay, well, let me just say that at this point, I did not have a mentor, and I was kind of picking and prodding at random subjects without really knowing where I was heading with any of it. So argon plasma regulation is a procedure in which you kind of look at the digestive tract and you zoom in, and if there's like a bleeding or something like that where blood is coming out, you can send a little bit of radiation at it and it kind of bloats up, and it puts it in the process of healing. Next, I did a research assessment over different procedures, and this includes endoscopies, colonoscopies, GI tube placements, all of that, and none of you guys know what that is, and I'll get more into that later, but I finally got to introduce myself to those different kinds of procedures and what I wanted to learn about and what I needed to focus on. So that kind of gave me, that was one of my better assessments, because it gave me an overall viewing of what I needed to be focusing on and what I needed to do this year. Bedside manner, I've heard a lot of stories about people just not having good interactions with their doctors, where they're not properly treating them or even investigating their symptoms, and it's very disappointing and very discouraging, and there's a lot of issues that come up, and doctors especially need to be more aware that communication is everything with the patient. If you're not communicating with the patient and they don't understand what's happening to their body and why, they're going to have problems later down whenever they're trying to go between a GI doctor and a cardiologist and all of those things. They're not going to be able to understand what's happening and why, and their new doctors aren't going to have the right medical history. It's a very big issue, and people just need to be more aware of what's happening to their body, and doctors need to be willing to spend the time to communicate with their patients. Communication is everything for a doctor. Next is the Medical Sans Frontier, which is also called Doctors Without Borders. It's a program that travels to different countries around the world to help treat people in war zones, and it's not associated with any political agendas, which is really cool. Like, I shouldn't say cool, it's not professional, but it's amazing. This is my ultimate goal. This is where I want to end up. So I definitely see this program in my future, and I took the time to kind of investigate it and figure out what I need to do, what kind of pay it has, how many years of my life I want to dedicate to it, because whenever I involve myself in a program that big, I don't just want to involve myself, I want to lead, and I want to, like I said, I want to unite and build and grow throughout different programs like this. Another research assessment I did was over UNT, which is a college that's pretty nearby, and the whole class took a trip there. And we got to sign up for our own classes and discover what our route to college was going to look like. So I took some classes. They were interesting. I definitely enjoyed myself. Seeing the college lifestyle is always exciting for an incoming freshman. But mainly, the most impactful interaction I had over there was with the OChem teacher. And everyone knows about OChem. All high school students know how OChem is, the bad connotation it has whenever you go to college. So I was talking to this professor who was amazing. She was so insightful. She talked about work ethic, which is something that comes up a lot if you're going into the pre-med track. And she said that as long as you put in the time, and whenever you go into a college class, be prepared to have that the curriculum will be cumulative. So everything that you learn is you're responsible for. So a lot of the students don't understand that whenever they come in. And she said that's what I should focus on, especially if I want to do pre-med. So that was really helpful overall, because at this point I was looking at what med schools I want to go to, and that's what a lot of the time that's what I was using my research for as I looked at the GI curriculum and majors and stuff like that. For my last this wasn't my last research, but these are all research highlights. But for one of my main last research assessments was different conditions that I found in the GI field. So that could be ascites, which is, well, this is just to name a few, but ascites, which is fluid buildup in the abdominal cavity, Barrett's esophagus, which is repetitive damage to esophagus cells by heartburn or acid reflux, and irritable bowel syndrome, which is the most common and is very often found in pediatric patients, of course. So that was great. And next, what else I was doing during this time was interview assessments. So the end goal of this was to find a mentor, but even more so was to gain a first-hand source of what these people had experienced as they were going down their medical path. So first, on the left corner, you see Dr. Kaplan. Dr. Kaplan was my first interview, and he was not actually a GI doctor. He was a colorectal surgeon. Well, I didn't know at this point if I was even doing GI or surgery, but he really opened my eyes to the broader questions. Since he wasn't a GI doctor, I had to focus on those. And he asked me, why did I want to become a doctor? What if I was out after the money? Good luck, because they don't make what they used to. And that did affect me. I'm ashamed to say that affected me, because I had to go back and look at, with all of these new roles and stuff, doctors don't make what they used to. And you really have to have an altruistic streak to pursue this career path. And not only that, but work on your intelligence and have that work ethic. So a lot of it is take or give. Oh, not a lot of it is take. A lot of it is give and not take. So that was really eye-opening. That was my first really eye-opening interview. And Dr. Kubalian, who's in the top middle, was the first female GI doctor. She worked at UT Southwestern, and she was one of the younger doctors I interviewed. We talked about the technicalities of the medical process, and whenever I say that, I mean college, the 1-year residency, the second year you decide subspecialty, and then you apply for specialty, and then the 3 years of fellowship, and it just kind of goes on and on and on because school never ends for doctors. But she told me about endoscopies and colonoscopies, which was almost the first time I learned about it, but she kind of walked me through the procedure so I could kind of understand it more in depth. She was really excited about her career, which that was the first time I got really hyped up because I knew I wanted to become a doctor, but since my idea of it was so vague, I wasn't particularly excited. But she was super hyped about her job. She was young, she was energetic. I loved her so much. She was amazing. And she also showed me these really cool pictures where like forks were in digestive tracts and like you could see it through the x-ray, and she told me psychotic people did stuff like it was really cool. Next, I interviewed Dr. Kellenberger, who worked in GI before but was currently a nutritionist. We also talked about broader subjects. We talked about the 1, 2, and 3 tests used to determine whether doctors are competent enough to practice still, because you have to refresh. You have to prove that you still have the knowledge as the years pass. He was very relaxed and friendly to me, a lot more accommodating than some of the people. I won't say that, but he touched on his college medical years where he described that his experience was not as good as it should have been. There were a lot of people trying to drag him down, and doctors who think they're all that, which I mean comes up pretty often if you think about it. So he described keeping yourself humble, and again, the communication with the patients is everything, and that don't be intimidated by their snooty tooty attitude, as he described it. And he also described or introduced me to the new MCAT, which is graded differently. And actually, my sister will be taking this because she's in pre-med right now, and they don't know what's going to be on it. So all the prep courses and all of that, they're not sure what's going to be on it. So that's kind of terrifying, actually. Luckily, I still got like 4 years to go until I have to do that. So hopefully, there's a lot more prep course accumulated by that point. But he was very nice, and I really appreciated his time because he was very busy too. Dr. Aurora is a GI at Presbyterian. Through him, I realized that I wanted to do really hands-on GI. He was the first doctor I interviewed who was really involved in research, and I'm really interested in the research aspect of GI. He had won awards for research, and he went out to conferences and presented his research and all of that. And he also had all these books to keep up on medical happenings, and he had this huge wall of just books in his office, and he's already got this tiny crammed office, and it's like stacked with all these books. So that was really cool. He also was the first doctor to talk to me about more personal things. So he talked about family and versus work. A lot of what he focused in on was that a lot of the negative aspects of your job get internalized. So that means you kind of, whenever you have a bad day, you're at home, but your mind is somewhere else. And that really does build up in a family environment. And so doctors tend to carry this around with them, and they become depressed. And it's really important that you focus on the positive aspects and know that you've done what you can. So he was very insightful in that aspect. I was really happy that he opened up with me, and it was also really cool because he got his degree at Duke. So I was like, wow, you're a genius. This is so cool. Well, all of them are obviously, like UT Southwestern, which all of them are involved with, is like in the top 20 of medical schools. So all of them are extremely intelligent people. So that was a little bit intimidating. And Dr. Blondett, on the middle bottom, was the first resident that I interviewed. And a resident is someone who's still going through that education process. So she kind of was able to give me a first-hand account of what her days were like and what her education was like. And actually one thing that she drew attention to for me was she took pre-med out of country in Puerto Rico, I believe, where college was only $4,000 a year. And so that was really cool, and I was actually considering going out of country for pre-med. I was like, that would be amazing to only pay $4,000 a year. And she was very insightful, and she was very relaxed and young, obviously. So she was also very open to keeping in touch with me and making sure that whenever I got a mentor, I would have someone to talk to. So that was very cool. Lastly, I interviewed the lovely Dr. Satay. Dr. Satay is amazing because she turned out to be my mentor, and for so much more. She is a graduate at Wellesley College and the University of Miami Miller School of Medicine. She completed her internship and residency in pediatrics and her fellowship in pediatric gastroenterology and nutrition at the at UT Southwestern. One of the reasons I chose her was because she is the co-medical director of the Claude Prestige Cystic Fibrosis Foundation Clinic at Children's Medical Center, and she's very involved with the education aspect of things. So what stuck out for me from her was that we came from similar backgrounds. We're we came up in the same familial situation, as in our mothers were doctors and they introduced us to it, and while we had other interests, doctors are what we ended up or not ended up, obviously for me, but what she ended up becoming. And she was able to incorporate her other interests as a teenager growing up to her final profession. So that was teaching. So she incorporated her teaching abilities into her actual doctor profession. That really interested me, and I really felt like whenever we met up at Starbucks, we really had a connection, and we just hit it off. Like, it was amazing. I love her. She's been amazing throughout this whole process. One of the main draws to her was that she was doing cystic fibrosis, and that's not entirely true. She introduced me to cystic fibrosis. Again, I was poking at the dark first semester and just pinpointing random diseases and stuff like that, but she drew me in on the research aspect of cystic fibrosis. Cystic fibrosis, if you look at the diagram there, yeah, right there. Okay, so this is a normal CFTR channel, and CFTR is a protein, a protein channel, which is a cystic fibrosis transmembrane regulator. So this is a normal one, and you can see that the chloride ions are moving. Yeah, this is about to get a little bit sciencey, but chloride ions are moving through it, and it's able to transport correctly. But this one, it's deformed, and there are different delta blah 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 for deformities. And what's happening is that the chloride ions are getting stuck, and this is causing the mucus outside of the cell to build up. So this is a genetic disease, and the main cause is the main problem is the sticky mucus building up on the outside of the membranes. So this causes like the regulation of salt to get really, really messed up. And I don't know how, like, if you hug or kiss a CF child on the forehead, you'll get salt like on your lips, like you can taste it. It's very tangible and it's very obvious. And this is both a GI problem and a respiratory problem. So for my original work, I was researching and researching and researching. They probably gave me like 30 textbooks, which obviously I could not read all of them, but I got to meet a lot of these patients during clinic hours and see how it kind of transported to different areas of the medical issues that they were having. Like, respiratory problems are a big disease, so their lungs are not able to fully function, which means that they like living up to 50 years is amazing for them because they can't breathe correctly, and it's really upsetting. So my original work, one thing about CF patients is that they have to take in like about 2,000, no, not even 2,000, like 3,000, 4,000 calories a day, which is a lot. And it's a struggle because they're trying to get fats that they can't digest and consume correctly. Like, the nutrients aren't making it to where they need to go. So I made a cookbook for this CFIT convention happening at the Dallas Children's Hospital. And you can see them, they're the little green thing on the corner. But they made about 100 copies. There's like 2 boxes of those in the corner somewhere, and they distributed to CF caretakers. The caretakers are there because CF patients can't actually be around each other because the infections can be translated through the air. So we were talking to like the parents and all of that. So I created that cookbook, and it was distributed, and I also got to meet a bunch of different people who had children who were in CF, and right there, that woman is Karen Shaw, who is the nutritionist that we talked to, because nutrition becomes such a big part of CF, and she talked to me about the different smoothies. I had one of those. They taste amazing because they've got like 3,000 not 3,000, but like 600 calories in each like cup, which is pretty insane. I gained quite some after I went to that CFIT convention, because they hand out food to you. Like, they hand out candy like nobody's business. They just try to give you any kind of calories that they can. So that was really fun, obviously. One part of, so after we look at the posters, we all kind of sit down and people present their research and the new research in the CF world. So I got to see, this was the first time I was introduced to specifics of CF, as in the different mutations, and I got to see what caretakers were having problems with, because they were allowed to ask questions about new developments. And the woman across from me, it was actually a couple. It was incredibly upsetting, is what it was. The woman would break down, and she shared that her child was diagnosed with CF newly, and the test isn't that good for diagnosing, because they're supposed to tell a couple before they have a child if their child will have CF, and the test wasn't accurate. So she had recently found out that her child had CF, and she didn't know how to deal with it, and there was a lot of emotional breakdowns for her at that convention. Obviously, the other people at the convention had older patients, so that was really impactful, because whenever I think of CF, I didn't really think of it as a life-threatening disease, which I should have. That should have been the first, like, topmost prioritized idea in my mind, but it shortens their lifespan by 30, 40 years. It's really sad, and there's no cure. There is treatment, but it's only so effective. So for my original work, the cookbook was that tangible product, and then a few assessments over what I learned and all of that fun stuff, but that was very impactful. So for my product, I am creating an abstract with my mentor. We are researching the effect of total parent nutrition on cystic fibrosis patients. So Dr. Sate and Dr. Karen are working together. Dr. Karen's the nutritionist, so they're working together to log how TPN is affecting their current patients right now. So they're logging like their BM or body mass index, and seeing how they gain weight, because the higher that the BIM is, and like to the recommended BIM, the higher the chances are that they're living successfully, or that their survival will last longer. And that's what they call it, survival, which is wow. But so that's what we're working on. And my part in all of this is I get to write the intro of the abstract. So that means I get to describe what TPN is, and when it's like given, and what it does, and what's in it, and all of that stuff. So the final abstract is due May 11th, and what happens is that if it's selected, then we get it. Well, we are making a poster, but we get to display our poster, and we get to talk about it, and I'll get to present the introductory part that I wrote. And that happens up in Ohio, so it's going to be pretty cool, because if it gets selected, I get to go up to Ohio, and they'll like fundraise that, so that's pretty cool. And the other thing is, if it's presented, period, not on a poster, but just presented, then they'll fly me up to Ohio, and we'll get to present the whole thing, which will be at a national GI conference, where I'll get to interact with some of the best GI doctors in the nation, which is amazing. So I don't know if I was clear about this, but the conclusion of our abstract and the graphs and all of that, it should show whether TPN should be given in the middle of treatments rather than as an aggressive last resort. So that is my final product. It'll be finished in about a month. So that's amazing. That's what I've been spending all my energy and time with. what I've learned during this entire experience is, of course, professional etiquette. You're walking around doctors all day. There's no way you don't pick up their lingo and the way that they act and all of that. So that has been amazing. That's actually affected me in other branches of my life. It's affected me at work. My boss has noticed. It's affected me in volunteer positions where I've gotten more leadership roles. It's actually affected me quite a bit. So that was really helpful. And another thing has been my work ethic. I've definitely learned work ethic here, because while I might turn in a weekly blog that we have to turn in, I might turn it in like a day late. Besides that, there's so much more that goes into it. You have to talk to your mentor. You have to figure out times to get there. You have to wake up at like 6 a.m. to observe procedures. And then not only that, but you're introduced to the work ethic that you're going to need in med school, which is I don't even have words. Like, if you wanted to get into a competitive med school, like, get ready for 15 hours of volunteer work every week and shadowing and getting 4.0 GPAs, which is impossible in college. But anyways, it's definitely pumped up my work ethic. And the other thing I learned is I need to learn what I don't know. That means researching, and sometimes it's just poking like in the dark, just like I did first semester whenever I was researching random things. But learning what I don't know is so important that I can't even describe it, because how are you going to compete in something if you don't know what you're going up against, or you don't know what you need? So again, this leads up to the next one. Preparation is everything. You need to learn what you don't know and prepare to compete if I want to go into the pre-med, and which I do, by the way. Through all of this, I've learned that pre-med is what I want to do. And that leads into my next one. Don't forget your end goals and why. I want to do pre-med, but I've heard so many things under my mentorship, so many doctors who just should not be practicing. Actually, not that many in children's. I should not say that, but I've heard stories from my mentor and her colleagues. Like, so many of them told me to get this book that called How a Doctor Thinks, and it's about communication, and it's about knowing your end goal, and it's all of that. And just know why you're becoming a doctor. Don't forget, and remind yourself. That's really important. Thank you so much for coming out to see me this year. Today, I know you guys are filled with busy schedules. Thank you, Dr. Sate, for being my mentor this year. You've been amazing, and I've learned so much under you. And I know Dr. Karen isn't here right now, but I'd also like to thank her for her part. So grab a cookie on the way out, and thank you. Okay. Stop the recording.